Okay. Hello, everyone. How are you doing? I see one person watching us right now. Please say hello and let us say hi back to you. I'm excited to be here again as always. It's a beautiful Saturday afternoon, and I have a special guest. I feel so honored to have my guest in today. So if you're joining, please share, have somebody to join us, and we start right away. Okay, so welcome, Garrett. Thank you for being here today. I cannot thank you enough. I really appreciate this. Welcome.
Thank you very much. The pleasure is all mine. I'm really excited to speak with you today.
Great, great. And we are talking, this is a very special series. We're talking about military's mental health. As we all know, this is my Mental Health Matters Facebook group, and we are all about increasing mental health awareness and decreasing the stigma that is attached to mental health. And we do this by highlighting different topics, mental health topics, and how it relates to different people, wherever you might be, from a pregnant woman all the way to an elderly person, male, female, whoever you are, we relate to it. And this time we are zooming in on our military families. We started 2 weeks ago. We're here today and we're discussing a specific mental health illness, a disorder that is common among military families relatively compared to civilians. And I thought I don't think anybody has the right as much as having someone who had lived it and is now currently helping other veterans, current service members, and even the general public. He helps everyone deal with this issue in a very special way.
Thank
And
you.
is going to teach us, tell us, enlighten us, answer our questions around post traumatic stress disorder. Welcome, Garrett.
Thank you very much. Yeah, fantastic introduction there. Brilliant. Yeah, I was in the British Army for 20 years. 15 of those years I was on the front line going to Afghanistan, going to Iraq. The remaining 5 years I transferred over to the Army Welfare Service, where I was able to help the soldiers and dependents of people that's facing some sort of trauma. May it be simple, may it be individual signs and symptoms such as anxiety or the full-fledged PTSD. But a couple of things I want to mention before we go into the questions and really dig deep into what PTSD is. Now, people often stereotype and say that people suffering from PTSD are only soldiers or veterans, but this is completely untrue. If you are suffering from mental health in any shape or form, go and reach out. It's not only soldiers that deal with this, it's everybody. But what I want to talk about is my experiences, but also point out the fact that my experiences are different from yours. You may be experiencing something just as even more traumatic, but yours are unique as much as mine. Now, if we look at a soldier, a veteran, a wife, a child, whoever it is that's in this formality, you'll be affected if one person is or has PTSD. But everybody can learn something from their own experiences. Maybe how they understand or how they treat other people, how they're treated if they do certain things. It's your own lifestyle that brings this to its own fractions, you could say. The thing I want to point out is there are differences between military and civilian. The biggest factor is the weapons, access to weapons. Yes, if we look at America or many other countries, you've got constant access to weapons, but this just means that you're much more of a risk to yourself and others. So if you do have any type of mental health issue or problem, again, reach out. Now, the other point to say that the difference between military and civilian is tactics. You are taught tactics.
Right.
If you're given, if you're understanding how the mechanics of a weapon works, you can understand how the mechanics of an enemy force works, may that be combatant or non-combatant. So if you are in the face of trauma, please reach out for help before it's too late and you start taking things into your own hands. Now, therefore, that's saying that when we look at how people act and react, if you do reach out within the military community, it is or can be a double-edged sword. So be careful. What I mean by this is when we look at the British Army, I'm as part of the British Army Coalition Forces, we've got a very, very good mental health stepping stones. But when you do reach out, one of two things can happen. You have two options. The first one is you could remain in the military. If you are diagnosed with PTSD, you can still stay in the army. But it comes with a lot of back and forth. It comes with a lot of waiting. And option number two is you could be military discharged. Should you be military discharged, it's a very slow process, but just prepare yourself. Use your resettlement if possible. Identify what you want to do. And if you are worried to reach out for the military community, then perhaps identify someone more independent. Identify someone that could help you, but not impede you. For me, when I was in the army, and I had PTSD twice. First time was undiagnosed. The second time was diagnosed. Now, it scared me. It really scared me, the idea of reaching out to a medical profession when I'm meant to be on the front line, helping those or working alongside those. That's the tooth arm, the pointy end of the stick, you could say.
So when you say that when you're in the army, you had PTSD, that is something that are like, okay, first of all, what is PTSD? A lot of people just say, I have PTSD whenever they remember something that is unpleasant. And I believe that, at least to anyone that will be watching right now, we've had some unpleasant events happen to us at some time. Is this what PTSD is? And on this note, I would ask that a soldier is asking, watching right now and saying, what is PTSD? How do I know that I have PTSD?
PTSD, it's a contributing factor to face something that's been very harmful or hurtful in the past is a contributing factor to PTSD. It'll be the trigger. It won't be the root cause. So you're generally fine with many soldiers when they join the military, they join from a less demographic area. They're joining from, say, council estates for myself, or areas that they don't have the best opportunities and upbringing as they're going to join the army. Now, that being said, if you look at the first 5 years of anyone, now I know we're going to speak about soldiers in general, but you have to have the foundations of PTSD before you join the military, before you join the army and go to these places. If you look at the first 5 years of any person, they are the most detrimental. The first 5 years of a child will embed the fight, flight, freeze, fawn, or flop. We can go into them a little bit deeper in more detail should somebody want to later on. But that's what's going to cause you to have the foundations of where this is. Imagine like a volcano that's dormant. When you're born, the volcano is dormant. If you're growing into a harsh environment, let's just say a council state in the United Kingdom or less demographical states throughout the rest of the world, you can have that volcano will start erupting. It start having lava and molten lava, etc. at the bottom. And it's gently bubbling away. As you grow into the teenage years, that volcano is growing up. It's getting bigger and bigger because you're getting used to it. Your homeostasis, your equality, your mental state is ever so slightly getting worse, or it's not as good as somebody who's had a better upbringing. People choose to join the army. Now, once you join the army, or I say the army stereotypically, I say, and throughout this, if you don't mind, when I say a soldier, I may refer to a soldier as a him. Now, I'm not being sexist. I'm just being very general. When I say the wife, I just mean the dependent. And I say the child was now they're going to be male or female. So if that's okay with you, and when I say soldier or say him, it's the same thing, although it could be talking about females. when a soldier goes through basic training, he is taught to become stoic. What I mean by stoic is he is taught to not show his emotion. When you're doing this pair fire team maneuver, when you're pushing forward and exploiting the enemy, you can't start crying or ask someone for a hug. You cannot do that. You need to reach into your training. You need to focus forward, and you need to look for depth positions and move forward, move on. So and if a soldier was to die next to you or get shot next to you, you can't break down. There's no room from that. You need to remain stoic. So when that soldier goes down, there's going to be people taking him back as you and the rest of your comrades will push forward. There's no time for emotion. And I think that's really important to point out the difference between military and civilian on the underlying grounds of what PTSD truly is. Now, as we're moving forward, and we get out of basic training, bear in mind all that trauma, all the stoicism is forcing you down that one line. You find that you don't talk about your emotions on downtime. So you're going to be talking with your colleagues, and they might say, "Do you know, I've had a really hard day." And it's like, "Right, let's go to the pub. Let's go to the bar and let's have a couple of drinks." You don't talk about any of the underlying triggers or the underlying symptoms. And when we talk about the symptoms can range from anything from anxiety to panic attacks, depression, your own negative self-image, isolation, sleep, the nightmares you have between not being awake. I don't want to say sleep because it's very far and few between. The flashbacks. Again, we're more than happy to talk about each one of these in turn, but many people, when they're in this state of mind, will have suicidal thoughts. They're extremely hypervigilant. They may be feeling numb. When they're looking inside of yourself, you just can't force yourself to feel anymore. There's just nothing. Massively amounts of guilt and shame. And one of the biggest key factors is anger and rage. Now, if you look at each one of them, each person is going to be different. By the way, if I'm talking too fast or if I'm not pausing, please just point that out and I'll slow down a little for you. If we look at how PTSD to other people, everybody is different and everybody reacts differently. If you remember what I said at a few minutes ago, is that volcano is not erupting, but the lava's there. It's when you start going into very hostile or traumatic situations that level of lava can come up to the rim, and it's at that point, it's at the crucial point of something extremely stressful happening that makes the lava erupt. The triggers that triggers all these different symptoms. Does that make much sense to you of what I'm saying at the moment? I'm guessing she's on mute, which is absolutely fine. So hopefully you can understand.
I forgot I was on mute. So, yes, I said it's making sense that you're really putting it across in a way that most of us can relate to it. But whoever is just joining, thanks for joining. Thank you, Tunji Ogundeji. Thank you, Janelle Mans. I believe, I'm not sure, Jalil, are you a veteran? Let me know in the comment. And this is our comment that stoic is a great description. Is it possible to be too stoic, or what is a good way to gauge this? And he also asked a question that what is the difference between PTSD and PTS? I will just quickly answer this from as a psych nurse practitioner. I'll just quickly answer this for whoever is listening, that PTSD is a disorder. That is a post-traumatic stress disorder. PTSD has to be diagnosed by a professional. PTSD often interferes with your daily living and functioning. Those who are exposed to any traumatic or life-threatening event would have a stress come from it. But within a month or so you have that post-traumatic stress. If something terrible, something bad happens to any one of us, it is natural that we are going to have that stress from it. You will remember it, you'll feel bad, it will shake you to the core. but it is not everyone who's got PTS that goes ahead to have PTSD, that will go ahead to have the disorder. So they can, you with PTS, you can get over it. You're able to put in your coping mechanisms, kicks in, and like he said, based on what maybe your environment, the support you get, you're able to just overcome it. But some people would not easily resolve it or overcome it, and they start having some of the symptoms, like if Garrett is telling us. So now, oh, great, great. Jalil said, oh, I'm a two-time veteran, U.S. Army and Navy. Thank you for your service. Thank you for your service. So, yeah, that's the difference between both. And now, as Garrett is telling us what PTSD is about and how it's different for each of us. I would now like to ask, because he's talking about what it looks like. Let me ask, from a wife of a service member or a veteran.
Can I just answer the first question that he was just asking? If it's
which being too stoic.
Yes.
Okay.
Just pointing that one out. When you look at if you can be too stoic, you need to look at other contributing factors as well. For example, depression. I'm not saying that in order to be stoic, you will be depressed, but depression is broken down to 4 different areas. And one of them is suppressing your emotions. And if you suppress your emotions, let's just say you're feeling really unhappy or you're feeling sad, you try and suppress that one emotion. But as you suppress that one emotion, you suppress all of your emotions. You suppress being happy, being sad, being angry at times. You depress every single emotion that you've got. So you become literally a robot as such. So when everyone that looks at you, they just see an empty shell. Now, if you're saying, can you be too stoic? Yes, you can. When you fall into the realms of being depressed, mixing the two of them, being stoic and being depressed, yes, that's when you start walking around life just living. You're not thriving, you're surviving. If that answers the question.
So, are there people who are not in the military that you've seen this kind of being too stoic, so the way they have the suppressed emotions? Do you see
Absolutely.
that
all the time? If you look at the way society is today in any country, it's very negative for men to show emotions. So what they do, it's having a stiff upper lip for the British. Generally, when we're going through, when we're trying to live life, if we show our emotions, we're almost chastised for it. We're told off. We need to hide that. And when things start happening to us, when we start facing traumatic situations, and we remain stoic in any shape of life or walk of life, that's where you're going to start walking around like that empty shell. So yeah, for men, generally we're not allowed to show emotion, and that builds stoicism. And when the more trauma we face, the more depressed we become, and the more of a robotic face. Does that answer the question much?
Yeah. Yes. If anybody needs more clarification, please let us know. For the audience we have today, thank you so much for engaging. We appreciate that. And so here's the question from me, hypothetically. A wife of a veteran or a service member is asking, why wouldn't my husband let me touch him? What's the problem? It's almost like I can't even move close to him. Night times are not as romantic as it's supposed to be or used to be. Why can't I touch my husband? Is this PTSD?
It's difficult because, as I said, PTSD is such a vast range. People can get sucked in saying, I'm having a bad time, but I'm having PTSD or I've got PTSD. What we need to identify is when a soldier is gone away, people change. The soldier changes, the wife changes, the children change, everyone changes. Throughout time, people always change. Now, it's that time apart that you're going to grow apart. It's not meant to be. If you're the wife and you see your husband go away in 6 months' time or a year's time, when he returns, then you expect him to be the same as he was before. But as that's happening, she is growing apart, growing different. For example, she's holding the fort. In essence, she is a single mother. She's bringing up children. And when the husband comes back, he's breaking her routine. He's disturbing her world. And she's still got this in her mindset that she's still waiting for the husband to return. But when he does return, he's not in the same mindset as he was before. So it's not going to be as rosy as she was once hoping. Now, she won't be able to relate to what the soldier's been through. We're going off the fact that the soldier has PTSD or has been in a very traumatic environment or kinetic environment. And she can't relate to that because, as I said, soldiers are taught to be stoic in basic training. Now, if the soldier's lying in the bed with his wife, he's not used to be touched. He's not used to being fornicated with or having sex. He's going to be on a different mindset. He's going to be on edge. He's going to be scared. He's going to be worried or anxious. He's going to be concentrating more on, have I locked, perhaps this could be the thought, have I locked every single window and door in the house? Have I checked under my car for any bombs? Have I, that noise that I've just heard, was that aggressive? Was that towards me or was that towards someone else? All the time, he's still in that mindset where the wife is still, my husband's finally back, we can get back to normal and maintain that normal thought process. Life events that we've had before, we can continue to grow a family, go on holidays, visit different places. You're in two different mindsets, especially at the very start. And if the soldier has really faced this much trauma, he won't understand what's going on with him. He will just be dealing with what's going on for him. So although she's hoping for this intimacy, there may not be any intimacy because that's not in his 45s. That's not in his that's not in his mindset. He's trying to protect the family from an unknown threat, rather than play happy families because the wife's been waiting up to a year for him to come back.
Right, but so relating this to PTSD and PTS. I mean, it's not all soldiers who have been deployed that will come back to have PTSD, but can you describe what it will be like for someone who might be diagnosed with PTSD? Because I want us to be careful not to say because you're having this or that, you have PTSD. But for those who typically have PTSD, what does that touching at night or intimacy, what could it mean?
Okay, I can only talk on this from my own experiences.
Okay.
Now, when I came back from Afghanistan, I couldn't sleep all the way through the night. I was scared constantly. I was worried all the time. As I was saying, in my head, I had to go downstairs and physically check all the doors to make sure I'd locked them. I had to go outside with a mirror every time I drove my car. I couldn't sleep all the way through. I'd wake up between being awake, if that makes any sense to you, in cold sweats, in worries and in panics. The smallest little thing would give me a trigger, and that trigger could be a flashback. But when we're looking at what flashbacks are, you can have positive and negative flashbacks. For example, if you was to meet me in person and smell my aftershave or cologne, that might take you a flashback back to when you were a child. I said, I remember my dad had the exact same fragrance, and and I used to have such great memories with him. But although that's a positive flashback, a negative flashback is I heard a female sneeze. And that sneeze was exactly the same as when I kicked the sand in Afghanistan or Iraq or wherever I was, and seconds later, my friend blew up. And you're right back in there. And this can all happen in 10 seconds. And then after that flashback has subsided and you're hyperventilating, you're worried and you're panicking, you then go into a panic attack. Again, you don't know which way's up. You're disorientated, you're scared, you're worried, you're unaware that your wife's next to you. And in fact, if she starts trying to come onto you as such, if she starts stroking your arm, then potentially that's one of the worst things that you could do, because you're now being attacked by a foreign person or somebody that you don't know when you're halfway through a panic attack. and it's scary. You don't know what to do. You don't know what's going on, and it's overwhelming. Now, it's the trigger that was caused, and maybe I just want to point out here that you may have PTSD, and that your time away may have caused the PTSD, but it might be a prolonged time. It might be days, weeks, months, years until PTSD kicks in. And the day before, you could be walking the dogs in the park, and the day after, you're a crippling wreck, lying on the hospital floor, begging someone to help, but no one understands what's going on for you. So if you think of all these things that's going on for a soldier or veteran that doesn't understand what's going on for them, but then you're getting into an argument with the wife because you're not giving her sex, you're not giving her the attention that she deserves, which she does, but you can't get it. You don't understand. Your thought process is, I'm driving my car, someone's overtaken me, I might as well kill myself. How can you relate that to you lying in bed, worrying about everything? Your thought process is going emotionally in one direction and logically in the other direction, when your wife is laying next to you saying he doesn't love me anymore because he's not kissing me or giving me any hugs.
Right, right. That's a really, I mean, that's a really difficult situation to be in, and I wonder how many military or service members or veterans are going through this, or even anybody that's ever had a life-threatening event. Would it be sexual assault, near death experience? You witness somebody, you witness something, because sometimes PTSD doesn't only come from what happens directly to you. It might be something you witnessed, and that's why our frontline workers, nurses, doctors, emergency response personnel, our policemen, paramilitary, anybody that, or maybe you're just on the road driving and you witness an accident. Anything like that can bring about or can be, a trigger for post-traumatic stress disorder. So as Gareth has described, if at any time you feel this or you have a husband dealing with that, I think that you're having a better understanding of what could be happening and why it's important not to struggle with this all alone. And we'll talk about the benefits of seeking help as we go on. So on a child's behalf, let me ask you this. I don't want to get my dad into trouble, but I'm scared for him right now. What can I do? That's a child asking, because we talked a lot about the spouse. The children also feel and see the tension or the struggle that their parent, either the female or male military member, they see the struggle. And so the child is asking, how do I get help, or how does my parent get the help they need?
This is a very difficult question, to be perfectly honest with you. Now, I can't imagine what it'd be like for a child if you're trying to put yourself into a child's mindset. Not many people, or not many children have a voice, and people get caught out in their own problems. They may not see the damage that's being undergone to their children. As I said, trying to look at life through the child's eyes of a father, to a father. Dad goes away in about a year, 6 months to a year, however long it is, and he comes back and he's very angry and he's short fused. The child is going to be very confused. Straight down the line, extremely confused, because it's going to be two different worlds. Depending on how Dad's going to be acting, he could start having a different parenting style to he once has, from nature versus nurture, or he may be a complete lack of boundaries. So Dad could be buying lots of gifts, or he could be really disciplined, but he could be unaware of his behavior. So what we're saying is, what can a child do in order to move forward, or not get Dad in trouble? As I said, this is difficult, but talk to an adult. Talk to your mum, if that's available, or talk to your teacher. You're not going to be getting Dad in trouble. And I think it's very important to point that out. you're going to be getting dad the help that he needs, not in trouble. Now, he or the son or daughter will see a change in behaviors. He's not going to like the change in behaviors, and that will have potentially a detrimental effect on the upbringing of this kid. The sooner dad gets help, the sooner the child can go back to a normal lifestyle. One thing I would say is start identifying patterns. Start writing down little things that you see different to help your dad. Bear in mind, I just want to point out here for people that's just joined, being stereotypical by saying the soldier is the dad and the wife is the dependent. So, yeah, start writing things down, identify the problems, speak open and honestly, and if it's unsafe to do so, don't approach your dad, especially if he's under the influence of alcohol, because that could infumigate them, make things, exacerbate things, makes things a lot worse. So take a step back, talk to mum, say that you want to conduct sex, but again, if says don't talk to dad straight away, perhaps talk to a local authority, such as the school teachers or social workers. You're not getting him into trouble. You're only getting him the help that he needs, because he may have fallen below the waistline, and many people may not have seen the changes in his behavior. But if you, the child, can help him, reach out. And another point to note, if it is becoming hostile, pack a bag, an overnight bag. And this goes for the wife as well. Hide it. Pack a couple of sets of clothes, your toothbrush, another bit or a spare toothbrush, and leave it maybe with the neighbors or with your parents. So if things do get too bad and there is no help to the husband or to the soldier or the veteran, then that can give you clear passage for safety. Don't tell him where you are. It's his last chance. This is, things are getting too hostile. I need to get out. You can still help him from a distance, but just look after yourself and look after your children.
Right. That's really important, and I'm glad you brought up the safety part of this for everyone involved. Safety is very, very important because, like you said, whoever is going through PTSD at the moment that something might be going on, they might just not be in control, and things can quickly escalate, especially if those that are around do not understand what is going on, and it might be really difficult. And I think that's one reason that it's important for our military members, veterans, and their family members, that if you have access to your VA service or a military healthcare center, use that, because the professionals there would understand what you're going through based on their training better than you going to a civilian hospital or healthcare center. Now I'm saying, use the closest and whatever is available to you, but by all means, if you have a special care, if you can access a military service center, please do that, because you're going to get, I believe, you're going to get a more robust and specialized care, because they would understand where you're coming from and what you might be going through. So yes, thank you for that. I have two questions here that I want us to answer before I ask you mine. And one is from Jalil here saying, is it possible to be diagnosed with PTSD even if the military service member hasn't seen direct combat? And the other question asked is, how can we prevent triggers for people recovering for or dealing with PTSD? Okay, I think we'll talk about that when we talk about treatment.
Okay. So can you bring up the first question again, please?
The first question from, can you have PTSD if you haven't directly been in combat?
Yes. So if we think back to what I said at the start, PTSD is like a volcano. At the very, very young age is what engages the volcano. So the foundations of PTSD is there from childhood or prolonged exposure to something. Now, what triggers PTSD is an event. That event can be anything as long as how you react to the event. Now, this event could be a very kinetic time away in a foreign country, people shooting at you or you shooting at other people, seeing death. It's still an event. It doesn't, the trigger could be something as simple as tripping over a curb as you're walking down the sidewalk. It could be something as simple as getting into an argument with your parents. It doesn't matter what the event is. That's what triggers PTSD. PTSD is already there in the background. It's just waiting for something that you identify as a reaction. Does that answer the question you're looking for?
Yes, I believe it does for him. For me, from my perspective as a civilian mental health provider, it's that PTSD. It's not everyone who goes to combat, because we have a lot of issues going on even in the military. In the military system that's got nothing to do with those who had gone to combat. So it could be sexual assault, it could be being bullied by one of your bosses. I don't know how you say the hierarchy. It could be an event, something happening between you and maybe in the team, because I know that the military is a team effort everywhere. When something goes off, like Gareth said, anything can trigger that. So it is not only combat that can lead to, or that can be a precipitating factor to developing PTSD. So yes, you can have PTSD without necessarily going to combat as a military person.
Yeah. If you think about the military as in general, now there needs to be lots of stuff going in the background for combat soldiers to go into combat. Now, there's only about 20% of soldiers that are combat soldiers. Everything else is logistics, or it's cooking, or it's transportation, or regardless of what it is, there's 80% of the military will facilitate the combat veterans. And it's not only the combat veterans that have PTSD. As rightly as you're saying, somebody that's been the IT part of the military could get PTSD from being sexually assaulted, or false allegations of rape, anything like this, anything that's traumatic to that individual, or how they perceive it as traumatic, can cause PTSD. And that's when it becomes overwhelming. That's when all of your symptoms simultaneously rage. If you look at each symptom, you can almost look at them like a demon. If every single one of these demons simultaneously rage, every single one of them goes in at you at the same time, it's overwhelming. You don't know which direction is up. The only direction you have is what you can see in front of you, and it will not make any sense to you.
Right. So now I have a question. I think they're related. How the first one, which is, how can I prevent triggers? How can we prevent triggers for people recovering from PTSD? And here is somebody sharing his or her experience. I can't see the name now. That growing up, I always felt that as a female, I was nothing but a sex object. Okay, this might bring out some trigger for some people. So please, if this is not comfortable for you, you don't have to watch this at this time. Please just switch off from here. That I was seen as a sex object. Men will always grab me, and there were no consequences for their action. And sometimes this person was blamed for what was going on. And the question is, now, any action from a man that is not comforting, respectful, or loving is a threat. How can I overcome that? I think we can weave this into the treatments we have. So help us answer this.
Sure. The first question, could you just highlight the first question again? Sorry. It's about being, that's the one, yeah. How can we prevent triggers for people recovering? There are many different things that you could do to stop having a trigger whilst you're being triggered. I would say that there's two very big ways to not get the trigger. The first one is the non-starter, and that's isolation. Move yourself away from any situation that's going to cause a trigger. It's not very effective, and it's not very welcomed at all. But if you're looking at how holistically, how strong it is to be triggered, there's only two ways. The first one, move away from everything. The second one is therapy. What I mean by therapy is hypnotherapy. If you can imagine what PTSD is, as I said, each one of these symptoms, may it be anxiety, may it be depression, flashbacks, regardless of what it is, it's a demon. It's a demon on your shoulder, or it's the devil in your ear, however you want to look at it. It's the inner critic that's stopping you from moving forward. Now, if you have these going on for you, you need to talk to your subconscious, because having simple, what am I looking for? What word am I looking for? Having simple things, countermeasures to get yourself away from what's going on, isn't the root cause of the problem. The root cause of the problem is what happened at the very base. Like the lady was saying just there, that she feels like she's a sex object. We need to talk to the subconscious, because the conscious mind is all about reacting from emotion. The subconscious is giving you that emotion, or is giving you that trigger. Regardless of what the trigger is, it's giving you it. It thinks it's helping you out. So when it says, if, for example, if you're walking down the street and someone takes your wallet out of your pocket and mugs you and beats you up, your subconscious says, this should not ever happen again. So what I'm going to do is give you severe anxiety. I'm going to stop you from leaving the house. I'm going to give you that much fear of leaving the house that you would much rather stay in the house than leave. The subconscious is saying, win. This is a score. Well done, me, subconscious, for stopping my vessel from leaving the house, because now I've protected it. It's no longer vulnerable because it's in the house. There is knock-on effects to that. There's problems with work, problems with socializing, problems with many, many problems. In order to get to the root cause of that, you need to go into the hypnosis, speak one-to-one with the subconscious and say, look, we need to find another method of getting through this. Because, as I said, the subconscious is about emotion, and the conscious mind is all about logic. I choose to pick up my pencil. I choose to look at my phone. I choose to speak here. This is my choice. This is a conscious decision. A subconscious decision is to stop me from picking up that pen, stop me from texting someone, stop me from going here and speaking to you for whatever reason. Because the demon on the shoulder is preventing you from moving forward. Under hypnosis, that's where the money shot is. That's where we can identify a way forward to change the perception of the subconscious to allow you to move forward. You can't, there are other methods, and I'm sure you're going to speak about them later on, like taking drugs or medication to prevent you or to numb something. I'm not going to go into that too much. I'll leave that for you to have a little chat with in a little while. But there are many different ways to blanket it, much like having an open wound or having a cut in your leg. If the blood runs down your shins, cleaning the blood away isn't preventing the bleed. It's just going to clean the wound up.
Right. So to the two questions, here's what I want to share with our viewers from my perspective. So for our viewer that shared this experience with us, the one good thing is that you already identified, it seems you already identified the root of where this problem is coming from. You can relate your behavior, your unpleasant or negative behavior towards men to what happened to you in the past, what you experienced, what you were exposed to when you were younger. And this is not your fault. Everything that happened there, however they had treated you then, that made you feel like you are a sex object, is not your fault. But the fact that you know that those unpleasant experiences happened, and now it's impacting your behavior towards other men. All we need to do right now is identify who can help you through this period, because as Garrett told us, you're still kind of stuck in that thought process of anyone that treats me this way is treating me that way just as I've been treated in the past. So
Mhm.
please seek help. And thankfully, we have Garrett here. He's an excellent resource. You can see the website that is scrolling at the bottom of the screen, the number, text him. You can do a discovery call that can lead you to you getting help, the help that you need, and getting out of that pit or this position that you're stuck in. And for those who are saying, how can you prevent triggers for people that are recovering? I'm glad that we have the word recovering there. That means that the person is already seeking help and now they are healing. What I would say is that if the person is recovering already, then you're seeking help. If you're seeking the right help, I'm sure that whoever is working with you, a therapist or a psychiatrist or a nurse practitioner that is working with you, either with psychotherapy or pharmacotherapy. You're either doing a kind of therapy or you're doing medication, or both together, which is the most effective. If you're already doing that, please stick with your treatment regimen. Be compliant with your treatment regimen. Be open and as honest as you can be with your therapist or whoever you're working with to get you there. Don't stop in the middle. Don't stop when you feel some relief. Don't stop because, maybe for a month or two you've been fine. Complete your treatment regimen. And those are the times that you're going to learn the tools to help you deal with your own possible triggers, because really we don't have control over those triggers. You never know, like Garrett said, it might be something as simple as someone sneezing. It might be something as simple as somebody turning on the TV and it's too loud, or it might be something as simple as you're just working in the store and there's something showing on the TV in the store that brings about that. So we really can't prevent the trigger, but you can identify your triggers and learn the tools to deal with your triggers. You learn the tools to cope with your triggers. And as different life events happen, maybe you relocate to another a country, or you relocate to another place, or you're changing jobs, or your kids are growing, your triggers might actually start changing, or the things you will be exposed to might be changing, and you would need to then modify your coping mechanisms. So those might be another thing, is you might need to just go back to whoever you work with to say, hey, things are changing around me. How can we modify my coping tools? And they would help you. So please, if you're already recovering, kudos to you for seeking help and working with somebody. Don't stop in the middle. Don't think you can need it again. Comply and do your best. That's what I will say to that. So now I want us to answer this question, and it's hypothetically from a veteran. The question is, how do I control my anger without drinking? How does anger even relate to PTSD?
Mhm.
And how can I control it without
Yeah.
drinking alcohol?
If we're looking at drinking alcohol, it's a substance abuse, and it's never the best thing to do is to drink alcohol or to use any type of drugs to overcome this. What I would say is anger is a secondary emotion. If you can think of any time when you have been angry in the past, you can identify that you've been hurt just before you've been angry, or something that's happened is making you hurt. For example, if somebody cuts you off while you're driving your car, just as you're being cut off, you are vulnerable, you are worried, you're somewhat scared of this person has put your life in danger, so you're hurt. Your immediate reaction is the secondary reaction is to be angry. Now, don't there's many different ways to stand back from being angry, but what I would say is understand your breathing techniques. Understand that if you breathe regularly. If you're starting to hyperventilate, slow down your breathing through to slow down your thought process. When you become angry, for the life of me, I can't remember. It could be cortisol. There's a chemical that runs through your brain. I cannot remember the name of it. And you instantly flash. You instantly become very angry as soon as you become or identify that you've been hurt. As you breathe in. Block breathing, 8 seconds in, hold your breath for 8 seconds, 8 seconds out, hold your breath for 8 seconds, and repeat that over and over again. Or pulsating your fingers on your thighs. These are all coping strategies, such as withdrawing from the situation. They're the coping strategies like grounding techniques. They do work, they're not permanent. As I said to you earlier on, it's like having an open wound which is bleeding. Grounding techniques are like wiping the blood away. The wound is still there, but it's not as messy. But you're not looking at the root cause. They don't get to the root cause of the problem. There is a reason why you are angry, and it's about identifying why you're angry. Anger is much like every other symptom of PTSD. Your subconscious is reacting to a situation. And it reverts back to its original learnt behavior. Much like I said before, like your fight, flight, freeze, fawn, and flop when you're a child. Again, for me, the best way to deal with your emotions and symptoms is to understand its origins. Find out the origins of the problem, and PTSD is the fallout of a negative environment. So one thing I'd say is to understand the patterns and understand the emotions and understand the symptoms. Take a step back and look what's going on for you, because everybody's different. Everybody will react differently to different situations and circumstances. So if you start writing down July 21st, somebody said something and I got really, really angry, and the anger started in my fists. The anger started in my chest, in my stomach. It started in my head. Identify where it is, and what you're trying to do is the cure. Well, to be fair, the cure is better than the prevention. And for me, the cure is always reverting back to the root cause of the problem. It's bringing up what's happened in the past, overcome what's happening in the past in a very safe environment. And that's where I, hand on my heart, say that my method or rapid transformational therapy is the best type of therapy that I've ever came across. And I said I was in the Army for 5 years in the Army Welfare Service. During that time, nothing was even close to as good as RTT, Rapid Transformational Therapy.
Rapid Transformation Therapy. And do you provide this service?
Yes, I do, yeah.
Good. So here you know you have a resource here. And the good thing about what Gareth does is that there's this free call you can have with him, the discovery call, to know if this will be right for you, if you need more, if you're going to need a combination therapy. But it's a good place to start. If you already know there's a problem, or you just have the desire to live better, don't label yourself as having PTSD. Seek help first and understand what is going on. Then you're able to know what will be effective for you. So reach out to him on the website. You can schedule an appointment and see Gareth. I recommend this if you even have the slightest feeling that there might be something related to this going on with you. Or for a friend, or a sibling, a spouse, a child, a colleague. Recommend this to somebody. It doesn't have to be for you, because remember, the better the lives of those around us, the better the quality of our lives as ourselves. So just recommend this to someone if you will. And I want to say this quickly about the alcohol. And here's something, here's a request I have here. I would love to attend another live that speak about the connection between PTSD and substance abuse. And I think we're going to honor this. We actually, the group members actually voted for PTSD first, and then we're going to talk about alcohol dependency. And I want to say that there's a study that shows that of about 60% of veterans that are entering into substance misuse treatment, substance misuse recovery treatment. 65 of those veterans had dealing this, their substance they're dealing with is alcohol. And this is, as we can see, we see in movies, we see in the lives of people around. A lot of times we have this alcohol misuse. In fact, they even portray it in movies. Like, it's almost like military people just hang, they just have to go to the pub, they drink, that's how they suppress things, they deal with what is going on with them. This might be stigmatizing, this might be stereotyping, it might be wrong, but the more we know about how alcohol is not the effective coping mechanism in whatever the issue is, the better for us in seeking treatment and in going ahead to have an effective treatment for us. So we'll talk about that. So I want to highlight here that treatment for can, okay, let me ask you, can PTSD be effectively treated?
100%.
Great. And that's the answer right there. It can be treated. Nobody has to suffer or deal with post traumatic stress disorder forever. You can have an event happen to you, be diagnosed with post traumatic stress disorder, which is not a label, but the map that gives us the road, the right path to the effective treatment for you. And we can have the evidence-based treatment for PTSD is not medication. It's not just medication. It's actually therapy. We have hypnotherapy, like Garrett does. We have EMDR, which is tell me that again. EMDR is eye movement desensitization processing. We have cognitive behavioral therapy. We have prolonged exposure therapy. Therapy is very effective. However, some people, to be able to take off the edge that will let them even settle down, calm down to have their therapy be effective for them, they need some medication. We usually, from medication management standpoint, we usually use SSRIs, which is serotonin, selective serotonin reuptake uh, inhibitors. So that's the first line. That's the trick. That's what we use. One of the things that people come and talk about or they ask for when they come for treatment is, oh, I need a benzodiazepine. I need a benzo. I need a benzo. It's going to help me sleep. Studies have shown that benzodiazepines are not as effective and recommended as people think it is. So you don't need to go get a clonopine or Xanax or any medication in the benzo class to get to treat PTSD. Maybe you need it for a while to use, but it is not the most effective for PTSD. We have SSRI, the class of antidepressant, that should be used in combination with therapy, because therapy is what you need the right therapy for you to be able to not just be cleaning the blood, not cleaning the blood off your wound, like Garrett is saying, but really dealing with that wound and making sure that it heals from within outward. So let's explore this and let's have that in mind. You can use medication in combination with therapy. What kind of medication do you need? Which one is appropriate for you? It has to be prescribed by a professional. It doesn't have to be a benzodiazepine. Another thing that we see is people sometimes deal with nightmares. We have a medication that we usually prescribe for nightmares if that is an issue. Sometimes we have medications that we might use for insomnia, which is problem with sleeping. Like he shared our experience with us, but it is not everyone that's got to use medication. But everyone really do need therapy, and we have a great resource here, which is Garrett. So thank you all for listening. Those who joined us, I really appreciate this. But before we leave, I would like Garrett to have his last words with us, his final words or with us.
Yeah, brilliant. Again, thank you very much for having me on here. I would just like to point out that if anybody does have any problems sleeping, and I've got a recording, it's a bespoke recording. I use 111's frequency along with a deep relaxation therapeutic recording, and that's on my website, or if you want it straight to your phone, just message me from the message below. And it does help you sleep. I've not had one person so far that it doesn't work with. I just want to reiterate, if you have any type of mental health problem, reach out. It doesn't have to be with me. Just reach out to anybody that is a medical professional and get the help that you need. And remember, my experience is different from yours. Yours are unique and you can learn from it. If you are in the military, be very careful about reaching out to some people if you want to remain in the army or if you want to become undetected. Find someone independent and then find out exactly what's going on for you. Then, in my opinion, go and reach out to the resources from the military. They are very good, but it's a double-edged sword and it can impede on you. But thank you very, very much for having me here. And if there's anything I can do for anybody, please reach out and please ask me.
It is such a pleasure and a great honor that you honored my invitation. Thank you for coming. Thanks for all that you've shared. And you are in our noble group. Please share resources with us, and we'll be glad to have you back. Thank you so much. For everyone who joined, we appreciate you. Thanks for asking the questions. Thanks for getting involved. Thanks for sharing this with other people. Thanks for inviting other people to the group. And I'll see you next week with another great topic as it relates to military's mental health. Before I leave, I will say this: my mental health matters. What about yours? See you next week.